This afternoon's In Depth, we continue to follow the latest on the spread of the coronavirus. Florida now under a public health emergency declaration. Earlier today, Governor Ron DeSantis spoke about the first cases here in Florida.
Now, those two individuals that tested positive remain in isolation at this time. Despite these cases, the overall immediate threat to the public remains low. With that said, we do anticipate that more will test positive, and we have taken additional actions to help contain the virus's spread.
So we want to help answer a few questions most people would be asking today. What does this mean? What comes next? And how should the Bay Area start taking precautions? Precaution is that key word here, remember. All right, joining me now to help answer those questions in depth is Dr. Deepa Verma from Synergistic Integrative Health. Now, thank you for taking time to join us today. Can we start at the beginning and let's talk about what the virus is? Now that it's here, we see everything everywhere. Tell us about what we're dealing with here.
So it's coronavirus. It's called COVID-19. It is a novel virus. Coronavirus is actually a common cold virus. It is one of the 7 identified coronaviruses. We've had SARS in 2002, the MERS, the Middle East Respiratory Syndrome, in 2012. This originated in Wuhan, China, in what we call the wet meat market. So it was a seafood and poultry market. So back sometime in December, we identified that what it is a zoonotic infection, basically animal to human transmission. There are human to human transmissions that are confirmed, but it's typically eating an animal that has been infected with it. It is thought that this coronavirus originated from bats. A lot of these wet meat markets capture these animals in the wild, and they take it to these markets to get slaughtered. Things like bamboo rats and civets, they could have gotten bitten by a bat, gotten the virus.
You would see in those Asian markets.
Yeah. But the problem is, you're going to say, like, if it's a common virus, why is it causing so much havoc? Why is it wreaking so much chaos? Is because when it mutates, and it's normally an animal virus, a zoonotic infection, and we get it in the human, we don't know how to basically deal with those mutated viruses. So this is what's occurring now.
Is that why we have the discussion of there's no vaccine for this? It just has to run its course.
It does. So the flu is a virus, okay?
Yes.
We have bacteria, we have pathogens, bacteria, parasites, fungus, and we have viruses. Viruses, there's no cure for a virus per se. If we get this virus, it's like herpes, chickenpox, EBV, they stay in the body and then they go dormant. They can reactivate. The chickenpox can reactivate as a shingles virus.
Right.
So when we get the flu, we let it run its course. Okay, we have the precautions. There are no real true things as antivirals. You want to mitigate the course, but you have to have good immunity. So when we talk about the elderly or children getting affected, those are typically people with compromised immunities. So they're going to be normal precautions, right? So
I think there's words that frighten people.
Yes.
Pandemic.
Yes.
I hear that thrown around a lot.
The travel, there's different alert levels. There's alert 1, 2, and 3. So alert 1 is just your usual precautions. We're looking at Hong Kong has that right now. Level 2 is going to be enhanced precautions, and that's where Japan falls under. Then we have the level 3, which are basically do not travel to countries if it's not essential. So that right now is Italy, Iran, South Korea, and China.
Yeah.
So that's under level 3.
I mean, China has locked their government, their people down, essentially.
They've isolated themselves right now. I mean.
And all of this is for a flu?
Yeah, it's the flu, but the way it gets spun is basically because if we look at the stats, it's a little scary.
Yeah.
So right now there's about 89,000 confirmed cases and almost 3,000 deaths. When we look at the influenza virus, it was a grander scale. We're looking at about 36 to 45 million people affected and about 32,000 to 45,000. So if you take the stats, it's going to be a less number, about 0.1% versus 3% with the coronavirus. That's what's making everybody really scared.
Okay.
The fatality rate is high because we don't have a vaccine. We don't have rapid diagnostic testing. Right now we have to send out the kits to the CDC, right, to confirm. So the 2 in Florida that have been confirmed in Hillsborough County and Manatee, one did travel to Italy. The other one we're not quite sure, but that's just presumptive testing. We need to have confirmatory testing.
How do we protect ourselves? Give us the basics of that.
The basics are like with anything else. Stay home if you're ill. If you have any signs of an infection, fevers, cough, respiratory issues, alert your doctor, go to the hospital. Wash your hands, do the 20-second rule. If you don't have soap and water, use a sanitizer. Cover your mouth when you cough and when you sneeze.
Yeah.
Those respiratory droplets can travel up to 5 feet.
Wow.
This is just common sense things that we teach kids, but we don't do it. How many times do we really wash our hands in a day? They also do not advise people who are well to wear masks.
Really?
They do not.
And why is that?
You're not getting the protection. I mean, this is, when you're trying to wear a mask, it's about to prevent those respiratory droplets. If you're well and you're not having any of those symptoms, it's not going to do anything.
It's not going to do anything.
You might be causing some other issues too. Also, there are certain types of masks people need to have, because the particulate matter can get through.
Where can we learn more?
I mean, you can go to the CDC site, you
Yep.
know, the World Health Organization, but always speak to a knowledgeable practitioner. I do many things as an integrative MD in my practice that heighten immunity
Yeah.
and help people, you know, in terms of treating the flu. I do IV therapy. I put people on many supplements. It's taking precautions to boost your immunity and just doing the proper hygienic and sanitary measures.
Live your best life.
Live your best life.
Thank you so much.
Thanks, Chuck.